Hello friends, welcome to my YouTube channel that is Study with DD. Let us study new topic today, that is Epistaxis from ENT. Let us know what is the blood supply of the nose. Up to middle turbinate you have external carotid artery, and above the middle turbinate you have the internal carotid artery supplying the nose. Now, how does external carotid artery supply the nose? It is through its two branches, that is maxillary branch and facial branch. The facial branch gives superior labial artery, whereas the maxillary branch gives sphenopalatine and greater palatine artery, which supplies the nose. Now, internal carotid artery supplies the nose through its ophthalmic branch. This ophthalmic branch further divides into anterior ethmoid and posterior ethmoid artery. Main thing to remember is the artery of epistaxis is the sphenopalatine artery. Let us study about the Little's area. Now, it is the most common area for epistaxis. It lies at the anterior-inferior part of the nasal septum. This area has Kieselbeck plexus of 4 arteries supplying the nose. Except posterior ethmoid, all the other arteries which we studied just now are the part of Kieselbeck's plexus. Now, this Kieselbeck's plexus is arterial in nature, whereas Woodruff's plexus is venous in nature and is in the posterior part of the nasal cavity on the lateral wall. What are the causes of epistaxis? The most common cause is the fingernail trauma seen in small children. Other cause could be hypertension, accidental trauma, bleeding disorders, anticoagulant use, hemorrhagic fever, local nasal causes such as polyps, cirrhosis, etc. Now, what is the management for epistaxis? The first and the foremost step is pinch the nose for 5 to 10 minutes with head bending forward, which is known as Trotter's method. Next step, if still the bleeding does not stop, is the use of nasal decongestant drops. If still the bleeding does not stop, you can do chemical cauterization of the bleeding spot with silver nitrate 1% concentration. Next step could be anterior nasal packing on both the sides. This packing is to give pressure on the bleeding area. PVA, also known as polyvinyl acetate, is example of such anterior nasal packing. Now, if still the bleeding does not stop, you can go for posterior nasal packing. Now, this pack, it has 3 threads as follows. As you can see in the figure, out of 3 threads, 2 come out of the nostril, whereas the third one hangs in the throat and helps in the pack removal. If by doing both anterior and posterior nasal packing still the bleeding does not stop, the last step is doing endoscopy and find the source of bleeding. After we find the source of bleeding, the next step is to ligate the artery. Now, the first artery to be ligated is the sphenopalatine artery. This procedure is also known as TELSPA. Next artery to be ligated if the bleeding continues is the maxillary artery. If the bleeding still continues, you can ligate the external carotid artery. Now, while doing the operation, how will you differentiate between the external carotid and the internal carotid? Now, the internal carotid artery doesn't give any branches in the neck, whereas the external carotid artery, you will find the branches in the neck. If ECA ligation also fails, the last step to do is the ethmoidal artery ligation. I hope you liked my video on epistaxis. Do like, share, comment and subscribe to my YouTube channel, that is Study with DD.